Plastic surgeon, neurosurgeon, breast surgeon, kidney surgeon, penis surgeon, gallbladder surgeon, liver surgeon. You want to know about these surgeons, but you don't get to work with all the surgeons. I'm Dr. Hassan. I'm an anesthesiologist. I get to work with all the surgeons. So let's get into their training, their work life, their type of work, and best of yet, let's get into their salaries. Let's do it. Before we start, please like, subscribe, do all that stuff for me, please. All right, let's start with the big boys, the neurosurgeon. If you want to be a neurosurgeon, you're going to have to study, be the top of your class in medical schools. Just remember, you're going to have to achieve very well in medical school, get into the honor society, maybe join a neurosurgery interest club, whatever. Then ace your away rotations. When you have an away rotation and you want to go somewhere, you got to do your best because there's only 200 slots in the entire country. So if you want to be a neurosurgeon, you're going to have to work really hard starting in medical school. Then, if you match into the residency itself, everywhere it says, according to the ACGME, you're supposed to only work a max of 60 hours. Neurosurgeons are probably the only specialty that routinely breaks those hours. On average, neurosurgery residents probably work 80 hours a week, and that's over the course of 7 years. Just remember, while most surgical specialties are about 5 years of training or 4 years, sometimes 3 years, neurosurgery is the longest residency surgery out there. So be prepared to work hard, extremely hard for your training, for your work life. Once you get into work life, the first few years as a neurosurgery attending, you're never going to see your family. So you're probably going to work upwards of 80 hours a week as an attending as well because you're just learning to do everything by yourself. You'll usually work underneath some sort of senior partner. You'll be doing most of the work. So the first few years are brutal and it doesn't really get much better and it's a really hard life. Now let's get into the salary. Neurosurgeons, highest paid doctors out there. Typically, they make somewhere between $700 to $1.2 million on average. Coming out, you could probably expect to start at the lower range, so probably $600, $650, then make your way up as you get more experience. If you become a chairman at a cancer hospital, you can make, $3-4 million a year. Now let's talk about job satisfaction. Neurosurgeons are some of the most motivated people out there. They're going to work extremely hard. They're going to achieve their goals. They're usually pretty satisfied with their job. Plastic surgeons. Everybody wants to go into plastics. They don't have a chance to understand what it involves. So let's go over what plastics involves. So you want to be a plastic surgeon where you're probably going to have to either do really well in undergrad, do well in medical school, and then do well in your residency program. Most of the time, you go from general surgery to a plastics fellowship. Recently, they've added more integrated residency programs so you can actually do a streamlined process. But just remember, there's really a limited amount of plastic surgery residency spots out there. So you're going to have to work really hard as a general surgery resident, ace your boards, go to the interest meetings, make friends with plastic surgery attendings at different places, and do your best to get a job that way. Now pay. Plastic surgeons are some of the highest paid surgeons because they don't have to deal with insurance. Everything is all cash. $20,000, $30,000 for a breast implant, and you can do 3 or 4 of those in a day pretty easily. So you do the math in your head. They're very highly paid. It's all cash, mostly cash. And you can go the academic route and do a reconstructive plastics as well for burn and cancer patients as well. Job satisfaction, you don't really ever meet a plastic surgeon who doesn't like their job. Working. Plastic surgeons typically work, 9 to 5. Very few, if no emergencies at all. So very high job satisfaction. The job market is the only thing you got to worry about coming out right now. Plastic surgery is extremely saturated. You're not going to be able to just graduate residency and move to Beverly Hills and start a plastic shop. If you want to start a plastic shop at Beverly Hills, you probably have to take a $1 million loan just to get the place, get the equipment, get the staff, and probably even more to run the place before you become profitable. So what I'm trying to say, it's very saturated. You're going to have to go to secondary markets and make your way up. Trauma surgeons. These are some of the most hottest fellowships out there. Every general surgery resident I know, when I was in residency and even now, wants to be a trauma surgeon. Why? It's because of lifestyle. So let's go through the training. Trauma surgeon, you got to do general surgery and then a trauma fellowship. That's typically 2 or 3 years depending on the program. Now, what's the work-life balance? The reason why people choose trauma surgery is the work-life balance. Normally, trauma surgeons only work 2 shifts a week. They usually do 1 or 2 days of clinic afterwards, and then they have the next week off. So they're kind of on a 1 week on, 1 week off, 1 week on, 2 weeks off type of schedule. They're highly compensated. Trauma surgeons usually make around $650,000 depending on where you live. Satisfaction, trauma surgeons are usually adrenaline junkies, so they're very job satisfied. Bowel surgeons. I'm going to lump general surgeons into general. General surgery is some of the hardest residency out there. General surgeons typically make $300,000 to $400,000. General surgery procedures include bowel surgeries, gallbladder surgeries, hernia surgeries. Job satisfaction, general surgeons probably 50-50 like it, 50% are meh. Usually general surgeons work a lot harder than all the other surgeons and they end up making less money, so I can see where they're coming from. Cardiothoracic surgeons, these guys are top notch. They're second on the tier of kings of the castle. If you want to be a cardiac surgeon, you're going to have to do really well in school. You're going to do well in undergrad, medical school, top of your class, do well on your boards, match into a program. As a resident, you can go either I-6 route where you do 6 years of just cardiac surgery, or go general surgery, cardiac surgery, Cardiothoracic surgery, thoracic surgery, it's a 2-year fellowship or 3-year fellowship on top of 5 years of general surgery training. It's job satisfaction. Cardiothoracic surgeons, some of the most satisfied individuals out there as far as surgeons go, probably even more satisfied than neurosurgeons, more in a happy way as opposed to an achievement way. Salary, cardiac surgeons typically start around $600,000 but can make up to $1.2 million depending on their experience and all those kind of things. Urologists, so wiener surgeons. These guys do the surgeries for your bladder, your kidneys, and your urethras. Urology training is 5 years, a little bit easier to get into than compared to the other surgical specialties. Right now, urology is a great job market, great salary. They're probably making anywhere between $600,000 to $800,000 on average, and partners at giant firms make over $1 million easy. Why is urology so hot right now? It's because the procedures, kidney stones, blasting kidney stones has become very, very more popular as the general. So urological surgery, there's a demand everywhere. You can probably get a job in any city you want after you graduate. Transplant surgeons. These are probably the most interesting ones. Now, transplant surgeons, in my opinion, have a very twisted route to get to where they're at. They usually want to do a little bit of this, a little bit of that. Transplant surgery is the same way you do general surgery. After general surgery, it's a 2-year fellowship or a 3-year fellowship or a 4-year fellowship, depending on which organ you want to transplant. Now, the heart and the lungs are done by cardiac surgeons. Everything in the stomach is done by transplant surgeons for the most part. Most of the time, transplant surgeons specialize in either kidneys or livers. Job satisfaction. Transplant surgeons are usually a little bit more flexible with their time. That's because a transplant can come in at any time, so you have to be kind of on call all the time around the clock. While the amount of physical labor inside the hospital might be less, you are more stressed because there can be a kidney that comes in at 2 in the morning or a liver that comes in at 3 in the morning, and then you're getting a 5, 6, 7 hour operation waking up at 2 in the morning. So transplant surgeons are a little more flexible than all the other surgeons. They're usually happier because they usually have more time off, but I have seen some transplant surgeons that are burnt out. So that's it for this video. If you're going into medical school, nursing school, any sort of specialty school, and you think this information can help, please do me a favor and share it and save it and watch it again when you're ready. Thank you guys.